Hello everyone, my name is Angel Tenorio and today we're going to be talking about the Kawasaki disease. Alright, so for definition, Kawasaki is also known as the mucocutaneous lymph node syndrome. It is defined as the acute febrile syndrome associated with generalized vasculitis or inflammation of the blood vessels, affecting all blood vessels throughout the body. Alright, for our etiology, the exact cause of the Kawasaki disease is unknown. Because it causes a high fever and swelling of the lymph nodes, Kawasaki disease is thought to be related to infection. It may occur in children who have a genetic deep predisposition of the disease, and this disease is not contagious. So for our predisposing factors, firstly, age. Kawasaki disease mostly affects children younger than 5 years old. Sex. Boys are slightly more likely to develop Kawasaki disease than girls. And ethnicity. Kawasaki disease is more common in people of Asian or Pacific Island descent. So for our signs and symptoms, Kawasaki disease has two phases. The first phase, or the acute phase, which can last up to 2 weeks and usually involves fever that lasts for at least 5 days. Other symptoms include red bloodshot eyes, a pink rash on the back, belly, arms, legs, and genital area, red, dry, cracked lips, a strawberry tongue, which looks like a white coating with red bumps on the tongue, a sore throat, swollen palms of the hands and soles of the feet with purple-red color, and swollen lymph glands in the neck. The second phase, or the subacute phase, usually begins 2 weeks after the fever started. Symptoms can include peeling skin on the hands and feet, joint pain, diarrhea, vomiting, belly pain, the development of coronary aneurysms, and all in all, in this stage, the risk of sudden death is highest. So for our diagnostic procedures, we have plenty. One is a urine sample to see whether it contains any white blood cells. White blood cells in the urine is a telltale sign that there's an infection in the body. Blood tests, again, such as the WBC counts or platelet counts. A lumbar puncture, a sample cerebrospinal fluid, is taken by inserting a needle between the vertebrae of the lower spine. ECG, this is a study of choice to evaluate coronary artery aneurysms in both fully manifested and suspected cases of Kawasaki disease. Imaging studies like MRI, MRA, CT are other non-invasive tests can be used to evaluate coronary artery abnormalities. Electrocardiograph or ECG, again, abnormalities in the ECG may indicate myocardial infarction or myocarditis. And cardiac enzymes, cardiac enzyme levels are elevated during myocardial infarction. Okay, so our medications and treatments, our principal goal of the Kawasaki disease to prevent, again, the coronary artery disease and to relieve symptoms. The standard for Kawasaki disease is IVIG, or intravenous immunoglobulin. It is most effective in preventing long-term heart damage when started within 10 days of the onset of illness. It is given in single dose to treat and reduce inflammation and thereby lessen the duration of fever. Others include aspirin. It has a synergistic effect with IVIG and has long been a standard of therapy for Kawasaki disease. And then anticoagulant therapy. Anticoagulants such as warfarin and heparin are used in patients with aneurysms in whom the risk of thrombosis is high. So, for our nursing responsibilities, first we want to monitor the coronary artery complications. This is for monitoring and managing potential abnormalities in the coronary arteries to prevent long-term cardiac issues. Next is to monitor any fever management. Again, effectively managing persistent high fever to alleviate discomfort and minimize complications. Monitor cardiac function. This is to regularly assess cardiac functions through tests like ECG to detect any abnormalities requiring intervention. Again, another thing is inflammation control. This is to administer appropriate treatments to control systematic inflammation associated with Kawasaki disease. Next is blood clotting platelet function. Again, this is to monitor platelet counts and managing blood clotting or bleeding risks. Eye and oral health, regular evaluations and care to address eye inflammation and oral manifestations of the disease. And lastly, follow-up care. This is to ensure regular checkups, tests, and imaging to monitor progress, assess ongoing symptoms or complications, and adjust treatment plans. Lastly, we go to our nursing interventions. First, we want to monitor temperature every 4 hours, every 2 hours if elevated. All right. Kawasaki disease initially begins with a high fever for 5 or more days in duration. Right. It provides sponge baths for temperatures over 101 degrees Fahrenheit. A tepid sponge bath promotes heat loss through conduction and evaporation. Next is to encourage adequate fluid intake as indicated. This is to prevent fluid loss, as fluid loss contributes to fever. Next is administer medications as indicated. This is, again, aspirin is an anti-inflammatory drug. This is to reduce inflammation. Next is to provide adequate bed rest. This is so that bed rest decreases metabolic demands and oxygen consumption. Next is to provide soft, non-irritating foods such as gelatin or jello, and provide cool liquids such as ice chips. Right? Soft foods require less chewing and provides less irritation to the oral mucosa. Ice chips is to maintain hydration and decreases mouth tenderness. And lastly, educate the parents about the information of the disease, signs and symptoms, diagnostics, and management. This is to promote understanding. Explaining the unknown cause of the disease helps alleviate any guilt feelings of the parents regarding the acquisition of this disease. Alright, here are my references, and thank you all for watching.